Hi, thank you very much. And thank you for inviting me to speak this afternoon. I'm Deborah, and I'm going to read that out just in case the people at the back can't read it. I'm a registered nutrition scientist. I'm a registered public health nutritionist, and up until the end of last year, I was a associate lecturer at university in human nutrition. And also, up until the end of last year, I ran a private clinic as well. And in my clinic, I saw quite a lot of people who are going through various stages in their journey in cancer. Various stages in their journey in cancer. So from newly diagnosed to going through active treatment to beyond active treatment. But ultimately, everybody was looking for, you know, the answer to progression-free survival, really. They were looking for what they could do with nutrition to help them to improve their chances of responding to treatment, and maybe the cancer not coming back again. About a year ago, I had my first GIST cancer patient in the clinic. Before that, I'd kind of heard of GIST. I knew what it stood for, but I didn't really know a lot about it. I did a little bit of research, and hopefully I helped this client with their nutrition. What I didn't know was at the time that I actually had GIST cancer myself. Fast forward until Christmas, and I received my diagnosis for GIST cancer. As well as my nutrition qualifications, I also have a master's in genomic medicine. So this meant that I had a good understanding of cancer genetics, and that also is the reason why I would see quite a lot of patients who'd got cancer as well. And I was told that I was going to be facing Whipple's surgery, which is a really big surgery, and I'd got about 8 weeks to prepare myself. And so I had to kind of start practicing what I preached. And, you know, I thought I'd got a really good diet, but even myself, this is my job, and I have to reset sometimes. We all need a reset. So what I'm going to do today is I'm going to run through what I consider to be, it has to be a little bit general because, you know, we've all had different surgeries, different response to treatments, etc. And so I think I need to keep it pretty general at the moment, but at some point in the future I'm happy to sort of dive into things in a little bit more detail. But I'm going to keep it general. I'm going to discuss with you what I consider to be the absolute fundamental day-to-day things that we need to think about, okay? Every day, from the moment of diagnosis, we need to consider these to improve our nutrition. I'm sure that you all do really well. I'd just like to say I was very impressed by everybody's piling on of the salad and vegetables at lunchtime. Like I said, these are, you know, the really important considerations every single day. We need to make sure that we're consuming the right amount of nutrients, okay, and the right amount of calories to support our energy balance on a day-to-day basis. So it's important to ensure that during the course of the day, every single day, we're having the right amount of calories and that we're having the right amount of nutrients in there as well, to support our energy balance, to support our recovery and our healing. And so for me, I knew I was going to be facing this really big surgery. I knew I wasn't going to be able to eat for a while, and I was going to lose a great deal of weight. And so I had to prepare my body for that. We need to be able to consume the right amount of nutrients in the right quantities to support our immune system, our organ function, and importantly, our mental health and our stress levels. And so I know now what everybody else is going through, that our mental health and our stress can fluctuate daily, can't it? When we're coming up to scans, when we're coming up to results, you know, it can be a really stressful time. And so supporting that is really important, and there's a lot that we can do with nutrition to do that. And something I tell all of my clients when they're newly diagnosed is that we need to prepare our house, our body, and our freezer, okay? So I spent that time from when I was diagnosed and I knew I was going to be facing this surgery, frantically batch cooking. And I advocate that all of the time because you're going to have days, everybody has days where they don't feel up to cooking, okay? They feel a little bit frustrated, a little bit stressed, they're really busy, they're really tired, and so batch cooking is really, really important. It's quite simple. Every time you cook from fresh, just try to make sure that you are doubling, tripling the ingredients so that you've got food in the freezer for those times when, you know, you just don't feel really up to it. So that's something that I really advocate, and I did a lot of. I knew I wasn't going to be able to eat solid foods for a while, so I was making lots of soups in little containers and putting them in the freezer. And this is something that I want to remind people about. I remind all of my clients, whether they're cancer sufferers or not, that we need to be focusing on what the balance of a healthy plate should look like every day for all of our meals. It should be divided like this. This is a great pictorial representation of the ratios that we should be seeing on our plate. We should be having half our plate of non-starchy vegetables. A quarter of our plate should be a good quality protein, and a quarter of it should be a complex carbohydrate. So complex carbohydrates, we're talking about pasta, potatoes, oats, grains, rice, for instance. And we are terrible, I think, as a nation, of doing things like having a whole plate of pasta and just sticking a sauce on it. That's not a balanced meal. And so I'm always telling people, actually, that pasta should be a quarter of the plate. And then we should have a quarter of a plate of the protein, and half the plate should be vegetables. And so that's really important. But sometimes I may say to people, we need to change those ratios a little bit. So for me, I was losing a lot of weight, and I needed to try and maintain my muscle mass that I was losing, and I knew after surgery I was going to lose a considerable amount of weight. And so I sometimes tell people, let's change that to a third, a third, and a third. It's important to not go a little bit too heavy with the protein, because then we can displace those other nutrients that are quite important to us. And so I went for that. We should always have a little bit of healthy fat on the plate. And importantly, we should consider the amount of ultra-processed foods that we have. As a country, it's really difficult because our access to food isn't always great, and we are often then led to having to, go for instant gratification foods that can be highly processed. But what I always say to people is it's really difficult to remove ultra-processed foods from our diet. And so a good target is to go for like an 80-20 rule, where 80% of the time you're using natural ingredients, you're cooking them from scratch, you know what those ingredients are, you know where they come from, and then 20% of the time, it's okay to try. I mean, obviously we should be striving for, not having any ultra-processed foods at all, but you will see the difference in your bodies. And another thing that I talk to people about that is fundamental every single day is nutrient density. And so nutrient density is the amount of nutrients per calorie. If we're thinking about nutrient density, every time we make a choice, then we're going to be ensuring that we get as many nutrients into our body as possible. And for those of us on this journey, this is fundamentally important for our health and for our best chances. What I want to do is just to talk about a couple of comparisons here, and the people at the back, you're going to have to trust me on the figures that I'm giving you, because you probably won't be able to see them. So it's about making choices. And so say, for instance, halfway through the morning, you're a little bit hungry and you fancy something to eat, and you've got the choice of 2 digestive biscuits or a pot of Greek yogurt. Which one are you going to go for? Now, I think probably you're all going to say, yeah, we know that the Greek yogurt is better for us, but I want to sell it to you. And the reason I want to sell it to you is because I want it to be something that people really think about when you're making choices over what food to put inside you to make the best choice possible. And it's all about nutrient density. Of course, it's okay to have a chocolate digestive biscuit every so often, It's about balance. So let's have a look at these. The reason I've chosen these is because they're both around the same calories. So 2 chocolate digestive biscuits is about the same amount of calories as a Greek yogurt. It's about 150, 155. They've both got the same amount of fat in them, but the Greek yogurt has got 3 times the amount of protein that the 2 digestive biscuits have got. So that's a tick for the Greek yogurt, okay? The Greek yogurt has got about a third of the carbohydrates that the 2 digestive biscuits have got, so that's another tick. Arguably, the digestive biscuits have got fibre in them, but really we should be getting our fibre from fruits and vegetables and whole grains, shouldn't we? We know that. So let's just have a look at it in a little bit more detail. Sodium, the government tells us that we should be reducing our salt intake, okay, to protect our blood pressure and our heart health. So sodium in the Greek yogurt is lower than sodium in the chocolate digestive biscuits at 85 grams and 113 grams But for me, as a nutrition scientist, what I'm interested in is the sodium-potassium balance. This is really important to get right for our cardiovascular health. Now, what we should be doing on a daily basis is consuming double the amount of potassium in our diets than we do sodium to get that balance right. In the Greek yogurt, we have that brilliantly. We've got 230 milligrams of potassium and 85 milligrams of sodium. So that's great. Another big tick, a big win for the Greek yogurt. The chocolate digestive biscuits, it's the wrong way around. There's more sodium than there is potassium in them. I know this is just one food, one component of people's daily diets, but actually it's important because it builds up over time, and we should be thinking about this. They've both got a good amount of chloride in, but the Greek yogurt has got considerably more calcium and phosphorus, like 5 times the amount than 2 digestive biscuits are going to have. Now, certainly for me, with my surgery, and I'm sure for a lot of other people, we need to consider our calcium intake. Yeah, we're not always absorbing it that well, and so we need to be considering the amount of calcium that we're putting into our diets and ensuring that it's optimal. And so another win for the Greek yogurt. And then, in the minerals and trace minerals, there's higher amounts of selenium, and higher, which is an antioxidant, higher amounts of iodine as well, which is really good for our thyroid and our digestive system compared to the chocolate digestive biscuits. Looking at the vitamins, there's a considerably higher amount of vitamin A compared to none in the chocolate digestive biscuits, and vitamin D, of course, which is fundamental to calcium absorption. B vitamins, overall, there's considerably more in the Greek yogurt, folates and vitamin B12 in the Greek yogurt. And then there's a much higher amount of tryptophan in the Greek yogurt, which is important. Now, tryptophan isn't a vitamin, it's an amino acid, but our liver can convert tryptophan to niacin, which is B3. And so that's, another good reason to be having tryptophan in our diet. And there's much higher amounts in the Greek yogurt. And so overall, even though it's not a B vitamin, it can convert to improve our synthesis of B vitamins. Furthermore, tryptophan is a precursor to serotonin, which, as we all know, is that feel-good hormone, and it's also a precursor to melatonin, which is a fundamental part of our sleep-wake cycle. It helps us to sleep well, and so many reasons to improve the amount of tryptophan that we have in our diet. I mean, luckily, any complete protein that you eat, you will have good amounts of tryptophan in anyway, but it's here in the Greek yogurt. So pretty much a win for the Greek yogurt, I think, isn't it? But what I'm trying to demonstrate is I'm just trying to sell the idea of how important it is to make the right choices and to think about nutrient density in our diet with what we're about to consume, because you can only consume so many calories in the day. We're all unique, we know that. And today we've heard it time and again that we respond very differently to drugs and we respond very differently to medication. You can have somebody who has the exact same cancer diagnosis with the same mutation, who is on the same medication, who will respond very differently to it. We respond differently to over-the-counter drugs. You will hear somebody say, I can't take cocodamol, and another person will say, I'm okay with it. This is all to do with pharmacogenomics, pharmacokinetics, which is responsible for how we are able to absorb and metabolize drugs in our body, and the way that we can metabolize them, how quickly how long they're in our systems for. We respond differently to medication. We respond very differently to surgery and the outcome of surgery. It can be a big trauma for our body. We respond differently to stress. We respond differently to our environment and the pollutants. And importantly, we respond very differently to food. Our digestive systems are different. They function differently. We can have different intolerances, and we will respond very differently to food. This is influenced by genetics. It's influenced by our hormones. It can be influenced by age, by our life stage, of course. It can be influenced by previous illnesses and comorbidities, by the health and diversity of our gut microbiome, and by our physical fitness as well. So there's lots of influences into how we can, utilize drugs and food in our body. And so if we're all so different, and we all respond so differently to things, why would there be a one-size-fits-all solution nutritionally? Why would there be a nutritional magic bullet that is going to cure or prevent cancer? There isn't. Everybody is very, very different. It's important to appreciate that. Personalised nutrition, we have some interesting science. We can now look at people's genes to see how well they may or may not respond to certain nutrients. It's quite exciting times. Watch this space with how that develops over the next few years. It may mean that, as with stratified medicine in cancer treatment, we may be able to use techniques to improve people's nutritional status as well. But I just want to mention misinformation as well, because the problem is if people see information enough times in social media, for instance, it kind of gets accepted as science, doesn't it? People just read the same information all of the time, and it sort of becomes science. It's really important to critically analyse things that you read, especially when it is regarding nutrition, because there's so many, if you Google it, there's so many different protocols that offer cures and better responses to treatment and prevention. It's everywhere in the news and on social media, and it's really quite difficult to determine the myth from the truth. And so what I always say to people is, if you are going down a rabbit hole of looking into something that you think is going to help you, ask the question, doesn't it, as well as does it, when you Google, and you will then be able to get information around sort of, the negativities of it. Some of these protocols can be quite harmful, and over the years I've had people, suggesting all sorts of things, that they're going to come off treatment and follow a protocol, for instance, and it can do more harm than it can good. However, there's some really interesting science going on. We have omics technologies that have been developing over the last 20, 30 years. We have genomics, we have proteomics, we have metabolomics, and these technologies are allowing us to personalise treatment and to start to understand. In nutrition, we specifically have nutritional metabolomics, which enables us to look at metabolites and how they might work in our body. So I'm particularly interested in the antioxidant and the anti-inflammatory pathways. So NRF2 pathway in the antioxidant pathways, NFKB, MAP kinase, JAK-STAT pathways. I'm not going to go into them, but there's some really interesting pathways whereby certain nutrients may influence those epigenetically. But we're certainly not at the stage now where we can tell somebody to start taking any supplements, any high-dose particular compound supplements that are going to help them. It's about ensuring that we get as many as possible. And so these are kind of just some of the antioxidant and inflammatory nutrients. So we all know where we can get fibre from, omega-3 from fish and seafood and oils and nuts. But all of these other compounds, of which there are many, many of them, for instance, phytonutrients, there's some 6,000 identified phytonutrients in food at the moment, and what we're trying to understand is their role in health and disease in the human body. But we are still in our infancy of doing so, really. And so you may see papers where they're talking about quercetin, for instance, and various different antioxidants. It's important that we don't jump on board and try to take high-dose supplements, and that we actually just look to food to provide those nutrients to us. And all of those nutrients come from plant-based food. So all you need to do is be ensuring that you have plenty of plant-based foods, lots of vegetables and fruits and legumes like chickpeas and beans and pulses, lentils, grains, oats, rice, soybeans, tea, coffee, berries, nuts. It's in all of these plant-based foods. You can find all of these compounds that we know are important for our health. And herbs and spices, often forgotten. Sometimes we'll add salt to our food to try and give it a little bit more taste, but actually herbs and spices have got lots of really important compounds that are beneficial for our health. But there's different types of these phytonutrients in different foods. Therefore, the only way we can ensure there's no one single food that's going to protect you from disease. You need to be able to be getting the protection from eating as many as possible. So it's about diversity. Part of a good diet, as much as food, is hydration. We often forget that. And when I have clients in my clinic, I do bioelectrical impedance analysis, and I can't tell you the amount of times that people are dehydrated. Even mild dehydration can lead to these symptoms: increased risk of UTIs, lightheadedness, dizziness, headaches, orthostatic hypertension, where you get up and you feel a little bit dizzy. So even mild dehydration, but fundamentally, dehydration can have an effect on our circulation, on our heart rate, on our lung function, on our blood volume, on our brain function, our electrolyte balance, our muscles. We need to be making sure that on a daily basis we're getting good levels of hydration. Of course, it doesn't always come from just drinking water. It can be from soups and other food that have got fluids in as well. But it's something that I do talk to people about because it's often forgotten. We often confuse thirst with hunger. We think that we're hungry, but actually we just need a drink of something. When I say a drink, I don't mean alcohol. Obviously, different surgeries can dictate when the best time, is to drink during the day. And something else that I think is really important to talk about and to think about on a daily basis is this. It's not just about what we eat. It's also really about how we eat as well. Now, everybody's going to start salivating when I start to talk about chewing, but it's really, really important, especially for us, that we ensure we get the best from all of the nutrients in our diets. So when we chew food properly, it stays in our mouths for longer. There's no certain amount of times that you should chew for. It should just be that your food is a very soft bolus before you swallow. The longer our food is in our mouths, the more chance that our saliva gets to mix with it, and we start the digestion process off. The longer that food is in our mouths for, it is triggering the chemoreceptors on our taste buds that is sending signals up to our brain. Signals such as sugar's there, so we should start to release insulin. So our brain will start to send signals down to prepare our body to be able to absorb and utilize those foods. The longer that the food is in the mouth, it triggers our control of our hunger and satiety hormones as well. And so if we are, those hormones tell us whether we're full up or whether we're hungry, and we get a much better regulation the better that people masticate their food. And we've got trials in elderly people whereby you get the people eating the same diet. Those that are still able to masticate well have much better muscle mass, they're less frail, and they have a better protein energy ratio. So that's the amount of energy that you can derive from protein. So all good reasons to be chewing our food up properly. It also has, as well as being able to absorb the food, it has an effect on our digestion and also may have an effect on the health and diversity of our gut microbiome as well. It reduces the chance of reflux and reduces the chance of discomfort. And so, like I say, it's not just about what we eat, but also how we eat. These are the important things I'm trying to pass on that you kind of already know, but we need a bit of a reset. All of us, all the time. So my take-home message from my spin around the block in nutrition today is that a varied and colourful diet is really important based on those ratios of the healthy plate model. That we should be making sure that we consume whole foods as much as possible and try to reduce ultra-processed foods and aim for that 80-20 rule. That we should be looking to good quality lean proteins and ensure that protein is part of every single meal for us. Sometimes a complete nutrition drink or a good quality protein drink can be really useful. So I was on holiday last week and I was a little bit worried about my access to good quality food. And so I just took some of those with me as a bit of a backup, and I did use them. We should be consuming plenty of fluids, and we should be preparing as much as possible with batch cooking for the days that we don't feel like it. And important, we should be enjoying our food. We should take the time to eat. We should enjoy our food. It's not only important for our physical health, but it's important for our psychological health as well. Food is just a joy. It's a really important part of our lives. So thank you very much for listening to me. And I'll take any questions.